I heard that I was on ECMO, and during that time my heart function got reduced, liver function got reduced, and kidney function also reduced, and it was very critical situation. And during that time doctors worked hard and they have given rebirth to me.
Mrs. Soujanya, she is a middle-aged lady who came to us because of significant breathing difficulty. Her oxygen levels were very, very low. She was diagnosed with a pneumonia where we see the lungs will be affected because of some form of infection. Both the lungs were significantly affected when she came to us. We started ventilating her with 100% oxygen, that is the maximum what you can give. With 100% oxygen also she was not able to maintain. Her blood oxygen levels were persistently falling down.
And then we immediately, when we saw the x-ray of the chest of this patient, then we could identify that it was a severe ARDS condition requiring high ventilator support and would also require ECMO. So timely intervention and timely shifting of the patient to our hospital here at Yashoda hospital, we could initiate her on veno-arterial ECMO. So ECMO is an extracorporeal therapy that we initiate for patients who are in severe respiratory distress and also have hemodynamic instability. That means when patients are having very low blood pressures, it helps in optimizing your oxygenation and optimizing your blood pressures.
I am Soujanya, working as a lead consultant in Signity Technologies. I have visited Dubai for tourism purpose along with my daughter. During last days I got fever. Once I am back, I was suffered with fever and I got 102, 103. I was on medication, but still that fever not reduced. My husband joined in the Yashoda hospital. I heard that I was on ECMO, and during that time my heart function got reduced, liver function got reduced, and kidney function also reduced, and it was very critical situation. And during that time doctors worked hard and they have given rebirth to me.
She came in a bad respiratory distress. She was intubated outside. So she came here, and then the intubation, the ventilation was adjusted, then prone position was tried, but her saturations never improved. Her cardiac function was also deteriorated. Her heart function was around 25-30%. Then early morning around 4 o'clock we have instituted VA ECMO. I was involved with my team in that conduction of the VA ECMO.
The ECMO can be taken off to the patient, and routine management like ventilation and medicines can be continued, and the patient can be managed accordingly. These kind of patients are quite sick in ICU. They have to be managed. They'll have, apart from respiratory failure and cardiac failure, they'll have kidney failure and liver failure. These kind of patients will be managed with the dialysis as well, and various medicines and antibiotics.
And she was also treated for pneumonia, and along with that we also did bronchoscopy to find out what is the organism which is causing this sort of pneumonia. And she was also treated with multiple antibiotics, and after a few days the patient started showing signs of improvement, and slowly we were able to remove her from the ECMO, and right now you can see the patient walking back to her normal life. So ECMO, which is an advanced form of a life support system, can be life-saving if initiated appropriately at the right time and for the right patient. So if the body oxygenation is not improving despite maximum use of ventilator, that is the point we need to consider an ECMO, and this can be life-saving for many patients. Thank you.